Welcome to Hacking Hypermobility Podcast.
I'm Luna.
And I'm Shelly.
And we're two bendy mamas.
Hacking Hypermobility.
Thanks for coming back for episode 3. Before we get too far into the weeds on the hypermobility diagnosis journey, we're going to take the time today to have a serious talk about the frustrations you might encounter based on our own experiences and some hacks we have developed on our own to help you along the way. Nothing's perfect, but we have some ideas.
In this episode, we're going to talk about the barriers in the diagnostic journey and that are preventing you from understanding what's causing your hypermobility disorder. And some of those barriers are more internal and some are more external to you. And so those are even harder to address. And so this is going to be a really emotionally charged conversation. So just be aware of that. Break it up into segments if you need to, if you get overwhelmed. And we're going to put together summaries and resources on our website, hackinghypermobility.com.
So due to the very nature of having a likely genetic disorder that affects many, if not all of your body systems, being a hypermobile affected human can be a very frustrating life experience. We're going to talk about those frustrations and give you some hacks for managing the things that seem to stand in your way to getting a diagnosis and the care that you need. So first, we're going to talk about those internal barriers, meaning those that are just part of our nature and common to our experience. And then we'll talk about some of the barriers external to our own bodies and minds. And while the zebra experience can be very similar, we're all different and we all cope in different ways. Primarily, we want to just allow you to give yourself the space to first, acknowledge and then be aware of the barriers to your care, but never forget that we zebras all have one thing in common. We're all strong and no one is broken on the inside.
That's right. So barriers for diagnosis. So first, we're going to talk about internal barriers, meaning those inherent to ourselves and the nature of the disorder. And so the first thing is neurodivergence. So Luna, what is neurodivergence?
So you may or may not have heard of the term neurodivergence. If you have met Shelly and I on other platforms, you've probably heard us use this term. If you're just listening for the first time, you may not have heard this, or you've maybe never heard it explained. So it's not actually a medical term. It's a term that the community of neurodivergent people created to explain the divergence in mental and neurological function from what is considered, quote, typical or, quote, normal. It references the various types of people whose neurological development and state are, quote, atypical. But truly not one version is neurotypical. It's a big variety of people and neurotypes in the world. While this isn't really a medical type of term, it was created for like-minded people to allow us to be more inclusive to these related neurotypes, but also to allow us to speak more collectively with more power. So neurodivergence is more common for those of us with inherited connective tissue disorders, with the comorbidities of both ADHD and autism spectrum disorder having been associated in medical research. And there's even theories as to why there are formal theories linking connective tissue issues and neurodivergent types such as ADHD and autism. Neurodivergence actually includes quite an extensive list of different medical diagnoses, not just ADHD and autism.
Yep. That's right. So there are also different neurotypes that present that are included under the definition of neurodivergence, but are medical in nature. So dyslexia, dyscalculia, epilepsy, hyperlexia, dyspraxia, ADHD, autism spectrum disorder, obsessive compulsive disorder, sensory processing disorders, though not yet recognized as a diagnosis on its own. Some professionals have been suggesting that it should be considered. PTSD, and even non-mainstream, gender and sexuality identities have been included in this umbrella of neurodivergence.
So what's interesting with neurodivergences, a lot of us experience something called alexithymia. You'll see it discussed in terms of autism communication, but also it's experienced in other neurodivergencies. It's basically the inability to fully explain in the moment or ever something internal, and I'm doing this right now because I struggle with this deeply.
I have this also.
Um,
I'm glad I have a
but
name for it now because
yes, I'm glad I can explain it now. So typically you'll see this presented in someone when they have a delay in processing the world around them, whether it be processing emotions, their sensory experience. I have pretty pronounced auditory processing delays. And for me, it comes out in my speech pattern, like what I'm doing right now. But it also comes out in like trying to engage one-on-one with people, or like in school, I couldn't take verbal instruction. It did not compute. I can't hear numbers, but I'm really good at math. Those are just some examples. There's other sort of like processing delays, like we have delays for struggles interpreting pain signals, hunger signals, any sort of body input and
goodness.
signals to the brain. This is a result of the neurological differences. So one of the other common things that you see in neurodivergencies is masking. And this is this term that we use to explain a phenomenon that is almost inherent and intuitive to the neurodivergent experience growing up. We don't necessarily realize we mask. Masking just means where we try to fit in with the rest of the world. I might, like mimic someone's accent or manner of speaking and mimic their facial expressions. Typically, I have kind of people have told me I have an autism accent. So like I'm kind of monotone and flat. But also in the same hand, everybody around me growing up made fun of my rubber face and all of my expressions and being really gregarious, and like I was called a female Jim Carrey. That was a mask. And I do it really
which is
well,
hilarious because he
unfortunately.
was in the movie The Mask. Anyway,
But
sorry.
Masking occurs in many different situations where we, try to fit in to protect ourselves. It's not just a neurodivergent thing, but it is almost universal with neurodivergent humans. I will say, as a side, that masking also keeps you safe practically sometimes, particularly as a disabled human or a person of color. You have to fit into the mainstream for your literal safety. But I'm also referencing, like emotional safety, that sort of thing. A lot of us also struggle with something like aphantasia, where we're unable to form mental images without having something like right there in your field of vision. Like it's a struggle to go to the doctor and explain, well, this is exactly how I feel. This is what's happening. This is my symptom. Because when it's not happening, I forget about it. I can't describe it. I can't explain it. I can't be real clear on the details of it, that sort of thing. In autism specifically, there are related factors that impact healthcare interactions, including verbal communication skills being affected, even when you aren't masking. Sensory sensitivities that are more difficult to manage in certain environments, especially medical environments being one of those. Challenges with our body awareness, processing, and challenges with organization. So everything leading up to a doctor's visit, the actual doctor's visit, and then processing what happens after, and then having a plan and an organization can be a challenge when you're neurodivergent. The healthcare disparities for neurodevelopmental disorders are only really beginning to be understood and studied, but it is acknowledged, it is known. I'm going to actually have us put in the show notes some links to some healthcare advocacy resources. Some are specific to autistic humans, by the way. And we would be remiss if we didn't mention the intersectionality of disability with other marginalized groups. Just going to leave that there.
So it's not uncommon for those of us who also have a physical disability to be affected by those challenges of emotional regulation and communication as well. And so it's also common for us to have depression and anxiety, right? And because that's common with everything else we're dealing with, it's easy to just put the blame, oh, well, you're depressed, you know? Other comorbid issues that come along with the connective tissue disorders are POTS, which is the postural orthostatic tachycardia syndrome, and other autonomic dysfunction. And that presents as anxiety and with anxiety. So sometimes it's hard to like break those up. The mind body disconnect, and this is something I struggled with. That is harder for you to process your emotions if your brain separates yourself from feeling those feelings, and it compounds the inability to identify the cause of your overall pain, which, as we mentioned, if you have communication issues, I mean, these are just compounding issues. So you can't articulate your symptoms clearly, and your pain perception is completely skewed because you're always in pain. So when someone asks how your pain is, like, to which pain are you referring? So there's also like the systemic disorder effects. So on top of any like brain fog that kind of overshadows all of it, right? Brain fog, that you're going to be tired, you're not going to sleep as well, you're going to have fatigue, which is going to ramp up your anxiety and depression. And so it's all connected, right? With these complex disorders, it's often difficult for us to tell our doctors just how impacted we are by all of these things, right? And how much it's impacting our loved ones as well. And so because the nature of this disorder is systemic and variable, th- that's the symptoms are overwhelming. Like I meet a new doctor and they're like, tell me why you're here. And it's like, I have to do this like mental calculus, like, okay, for this doctor, where should I start? So there's always changing needs, moving targets. And frankly, that's exhausting. Like you're tired of trying to find answers, right?
Healthcare fatigue is a real thing with us and avoidance, but because of all those experiences and the challenges with getting a diagnosis and help with managing your symptoms, your past healthcare experiences have likely been a little bit lacking. So you may have had inappropriate interventions, and these poor past experiences have probably resulted in a little bit or an extreme amount of increased psychological and physical distress. The understandable adoption of coping mechanisms that can sometimes become a barrier to further management. Like we put up a wall of distrust after medical mistrust that can even go into realms of medical abuse and gaslighting. The ways we've learned to cope with these challenges without support can be things that, were necessary for us to cope, but may no longer be serving you well. You may need to face. So you may have a tendency to have people-pleasing behaviors. That's very common in neurodivergent humans, particularly if you were assigned female at birth or living as a woman. We tend to minimize or hide our experiences. It's not as bad as it seems.
Other people have it worse than I do, so I shouldn't complain.
I'm not that disabled. I can still do this. It's not as bad as somebody else has it. It's not as bad as I'm making it out to be. I'm just anxious.
The doctor said I'm fine, so they went to med school. What do I know?
It must all be in my head.
Yeah.
And then, that's just going to further encourage that mind-body disconnect where we struggle with things like proprioception and alexithymia, that emotional disconnect from trusting your own body.
Yep.
And that's why I said that's maybe something we need to look at on doing. So the way we have learned to cope with some of the internal ones that we've experienced, vary, of course, but some of these experiences are fairly common. There are some common systemic issues external to our experience that we encounter as well. The biggest one is just the general lack of awareness and training on the inherited connective tissue disorders and identifying hypermobility and identifying the cause and managing that in patients. So there's a lack of awareness in what we call primary care, the general type of doctors that, are doing your annual checkups and seeing you when you have an initial complaint. It's my opinion that care should be managed there for most hypermobile humans. There are no EDS specialists. There are no doctors that specialize in connective tissue disorders. Even some rheumatologists and geneticists won't see us.
No.
So, we have to call ahead and find them. There's an approach in healthcare, in medical training, there's an axiom to treat the most common cause of an issue first. But oftentimes the investigation stops there. So if you're fatigued, they assume, oh, it's a sleep disorder, it's anemia, it's depression. If you present with mental health symptoms, they're likely just going to say this is depression or this is anxiety and just give you a pill and call it a day. If you are depressed as a result of coping with a life like this and as a result of disability and pain, you may go through cycles and cycles of prescriptions being told, well, let's try this one, let's try this one. And so we just stay in that pharmaceutical intervention cycle rather than investigating the cause deeper. And when you experience chronic pain and severe pain, some things start to happen with your interaction in the medical community. It can eventually put a stigma on you and your interaction with your provider. They frequently will, see a young person with pain and it's blamed on like stress, trauma, injuries. And you think, oh, okay, well, I hurt this. So once I get through this round of physical therapy, it'll be okay. A lot of us are diagnosed young with arthritis. Not everybody, but a lot of us are. And so they just say, oh, it's arthritis. And then on the worst end of the spectrum of dealing with a pain presenting person, you may be seen as like an addict or drug seeking when you're just complaining about pain. Even if you're not asking for pain medications, you're just saying,
Right.
I'm in pain, this is not right.
Or
This isn't the
attention
alarm bell.
seeking. Oh,
Yeah.
why are you
Like
here?
you're histrionic or whatever.
Yeah.
And then maybe you even shut down. Like that's what I do. Like I just avoid it. And so then it presents as depression. A lot of us deal with what you mentioned, that the brain fog thing. So then you might be investigated.
It's on full display right now.
Yeah. you might you likely experience this. Brain fog is kind of, I would say that's one of those things that's just very general to us. If you're lucky enough to be evaluated for ADHD, you might get some interventions with that. But likely, we're going to be looking at things like nutrient deficiencies, sleep disorders, thyroid, stress. It's going to be blamed on those little things. And then the catch-all favorite, particularly for women zebras, is just lose weight. So my point in this is you may have like a stack of little diagnoses that kind of explain bits and pieces, some medications that just don't really seem to solve the problem. And it's just frustrating. And the other part of this is just getting access to care can be a challenge. Shelley, what do I mean? Like, can you give us some examples of what I mean by the access challenges to healthcare for hypermobile people?
Well, if you can find someone to actually take you as a patient, which is hard enough in and of itself, you may have to wait a while to see them. And that was before the pandemic, right? And now there's quite a healthcare backlog because a lot of routine care was pushed aside during the pandemic. And that is now, in some cases, for some people, it hasn't become routine care anymore. It's like emergency care because routine care was ignored, right? We're making a dent in awareness of these disorders, but with that comes an increase in demand for services, which are already feeling the crunch, right? So it's just, I mean, unfortunately, your wait times might get worse as far as any specialists with regard to connective tissue disorders are concerned, okay? There's also limited access by where you live. I mean, where you live is a big factor. I'm really lucky. I live in the DC area. I have a lot of very good, reputable, well-respected institutions nearby that fortunately take my insurance, which takes me to the next thing, which is insurance coverage. Like your insurance carrier may not want anything to do with getting the testing done without having you jump through a bunch of other hoops first, which is, I mean, anyway. And again, as far as like where you live, tied into that is distance, which can be a factor, not just because of travel and like the cost of travel on our bodies, but the cost of travel in dollar bills, right? So just and also if you find a center that you can go to, you'll be very, very lucky if it actually is an integrated EDS type clinic, right? So there's that. Then, we're dealing with a systemic big picture problem here, right? Like with your body. And so, we were talking about the disconnect body mind, connecting that back. Like Western healthcare is not holistic, and we've got a whole body problem, and we like to um, treat it like bits and pieces, right? So like we silo it. It's like we called that when I was a consultant, we called that stovepiping, right? Like you've got all these little stacked silos, same thing. You've got, oh, your tummy, you're swallowing, you can't swallow, go see this GI person. Oh, but you've got these other nerve problems, but it seems like it's your phrenic nerve, but swallowing problems, go see a neurologist for that. But like no one stops to think like, oh, are those connected? So that's, they just anyway, it's misunderstood. You you might have an incomplete or a misdiagnosis for years. For years, I took hydroxychloroquine for inflammatory arthritis. I don't have that. I don't have it. Also, I had a B12 deficiency, and they didn't want to treat me for it right away, even though I had every single symptom of a clinical B12 deficiency, but my numbers were just just in the like normal range. So they were I had to fight for them to give me a like a $1 B12 shot. If they even understand the disorder, if they understand that it's not just, oh, you're a tall, skinny, bendy person, like they don't, if they understand that like a short statured, heavier person can have this condition also, right? So many misdiagnoses, even if you sort of get a diagnosis, right? So, like, they'll say, you know, it seems like you've got a little bit of exercise intolerance. So, manage it this way. But then they never stop to think, well, what causes that intolerance? Oh, that's POTS. Or you've got a lot of allergies, take some Benadryl. Oh, Benadryl's not working for you anymore. Switch to Claritin. Claritin. Oh, you're done with the Claritin. Time for Zyrtec. You're done with the Zyrtec. Let's get Zizal. Am I making that one up? I don't remember. There's so many. Let's not figure out why your body's responding this way. Let's just keep giving you more, band-aids. So, if you have chronic back pain and neck pain that, kind of ebbs and flows with some treatment, but they work on that, but they never actually say, why is your spinal area so unstable? They'll just say, oh, it's idiopathic. No, you just have this idiopathic condition and it's an unknown cause. And you know what? We don't know what causes it. And we're fine with not knowing. That's cool. Get some imaging done, but it might not be the whole story. I had some imaging done, and the results, if they're not concerning necessarily, if you're 70 years old, okay, so I'm 45, right? So that's not, there's something else going on here, right? I mentioned earlier subclinical labs, like things are a little off, but not off enough, right? They don't want to deal with that. And other symptoms that are interdependent on each other, right? So sometimes if you fix one problem, another problem crops up that's caused by a third problem, right? So there's this like, we called that the fraud triangle. When I was in graduate school and doing investigations, you need these like three things, right? But it's like a sliding scale of how much of one causes the other. And so like that's how I like to think of like the interdependent symptoms. Goodness. And then there's like, I don't know if you guys know this, but there is bias in the medical field. So what are some of those biases, Luna?
So I think a lot of us tend to just accept whatever a doctor knows and says. You've heard of the whole God complex, or, the superiority that you feel from a physician when you seek care, the automatic respect to their education and their years of experience. We tend to just defer and accept societally a doctor or medical provider's, approach and opinions. But in actuality, doctors do not treat every patient with the same level of respect and care. There are implicit biases and some that are a little more malignant in the healthcare field, same as every other field. It has been studied. There is well documented bias towards people assigned female at birth, AFAB, but it still persists. There is, of course, a great deal of weight and gender bias that, as a woman, I'm sure you've probably experienced. But there is also great mental health stigma with certain symptoms, complaints, and diagnoses when they present with a medical professional that may be all they see, and then they discount the rest of your experience and your perception and your other complaints. And frequently, particularly women with certain symptoms, can be just written off as psychological in nature. Those of us that are marginalized in society somehow are frequently minimized or ignored when we come in with complaints, whereas another person with more social standing, acceptable neurotypes, money,
Yeah.
skin color, etc., would be respected more for their presentation. So other marginalized groups face devastating bias in healthcare as well, particularly race, class, sexuality, and gender. This type of bias can leave anyone feeling isolated, disbelieved, and lacking trust in those of the individuals that you are supposed to trust, your
Yep.
doctors. So I think TikTok can be a little biased too, because the other day I tried posting something and it took it down.
What?
Yeah. So
What?
you know that TikTok trend about like no piece of artwork has ever affected me. And then
No,
it has
because I
the
don't know the trends because I know. But you'll tell me about it. Yes, I know. I don't.
well, and I think also I'm on like, the art side of TikTok, so maybe I get things that maybe the rest of I
Yeah.
don't know. This is the side of TikTok I'm on. I don't think you're on.
No, I'm not on art TikTok. Although I
Okay.
wouldn't be mad about it.
Yeah.
I'm just
Oh,
not there.
so
Anyway,
there's
so okay.
this TikTok trend that I love, actually. And so have you seen the TikTok trend with the Mariana Cross song? Mariana. I can't sing. So, okay. So I think it's funny that, like, when you realize that you're on, like, you think something is a TikTok trend, and isn't. It's
I
just
think
you.
no, it probably is a trend. I just like we discussed, I'm not on art TikTok.
Yeah.
And I don't
I,
and I'm older than you. Like we don't.
there's not that big of a gap. But okay, so anyhow, here's the trend. There's this song, and there's a shift in the song, that goes with. So at the beginning of it, you know say, well, no piece of art has ever affected me, and then after the song shifts, then it shows like the devastating piece of art that totally like guts you, and then the shift
Okay.
in music kind of matches that. Okay, so it's powerful,
Okay.
and
I can
and
see. And
I
you're
like
good at
that.
those. I can see you doing something like that.
It's
I,
literally emotional in
right.
art too, right? As a zebra, I had one in mind, and I had something I really wanted to post, but it got taken down for nudity.
What?
Which so we will. I'm so worried that I'm going to lose my TikTok account because I've had like a couple community violations. And so we'll link the piece of art here. One of the things I've struggled with as a zebra was feeling like I've lost a part of my identity due to my struggles to integrate my disability into my identity and practice as a visual artist. Literally losing, you know, the the physical abilities in my hands, but also like losing the inspiration, the energy, the creative aspects of like wanting to do something beyond just get through the day. So my biggest hypermobility hack is don't lose yourself, because I did, and now it's a struggle. Anyhow, many visual artists have affected me being a creative person. I went to art school, in case you all don't know. But Frida Kahlo has been really special to me because of her multiracial background
Yeah.
and
Struggles.
um, her struggles with disability. She also, as I've gone through life, I've spent a lifetime obsessing over and studying Frida, and kind of facing my own reckoning with disability is why I posted one of her paintings. She has many very powerful paintings to do with disability. But the painting from 1944, La Columna Rota, or the Broken Column. If you don't know her history, basically, she did have some
Some
disabilities.
accidents, right?
She had when she was a young woman in school, actually, she was in a devastating trolley accident. It affected her spine, her pelvis, her ability to bear children. It was a very devastating accident.
And that happened when she was pretty young, right? You said?
Yeah, a young teenager. And
Gosh.
she spent most of her formative years after that, in a bed, in casts. And then her whole life was defined by her medical treatments. And she rose above it in some of the most amazing ways, particularly in her expression of her life and her body of work. But when going through a challenge like a serious health condition, we tend to leave behind a piece of ourselves. And what I love about Frida Kahlo is that when she was immobilized after the accident in a like basically almost a full body cast, that's when her family gave her paints and she painted on her cast.
Oh.
And so she, at her lowest, is when she found her power. And it's also where she found meaning. So she transmuted all of that pain and suffering, both emotional and physical, into a body of work that we still feel and see today. So it's just such a powerful
That's
thing to me.
yeah.
So we tend to lose a bit of ourselves, our identities in this journey. You may not be a painter that doesn't paint any longer like me, but reflect on which part of your broken core self, your wild little child you, the things that you're passionate about, your identity. What part of you have you like forsaken or left behind on this journey? because those are the things that we forget about that we shouldn't be. So Frida once said, I'm not sick, I'm not broken, but I'm happy to be alive as long as I can paint. So that is one key thing that will help you face the next part of your life as you go through this. Part of this journey is not giving up on yourself.
Yeah.
But there are some practical things and some steps you can take to help you face these challenges. So that leads us into, let's talk about ways you can accommodate yourself.
Okay, accommodations. I'm assuming you're not talking about a stay at the Hilton. So
I mean,
let's
if you need to stay at the hotel to get away from all, that could be one, but
right.
I mean something a little different.
Okay, so what are these accommodations?
So accommodations are reasonable adjustments that can help you to address these barriers that we've talked about. The only control you truly have in any challenge in life is your approach and your attitude, your how you maintain your inner and outer self, right?
Yeah.
We can't really change those external things alone on our own. I could go off on a whole tangent about how the collective should rise up and stand up for disabled people, but I'm going to put that over here for a minute. We can't change systems of oppression or other individuals. This is discouraging and hard to accept, and you can go through a whole existential crisis like I have. But don't.
So so I think you're a little farther ahead and actually actively thinking about accommodations for yourself. So can you give us some ideas about how you accommodate yourself and your baby zebra, and like the challenges you face?
So, Shelly, I'm going to be honest with you. That's why I'm further ahead, because I watched my child go through a devastating progression into um, being severely affected by symptoms associated with what we now um, are based in her Ehlers-Danlos syndrome diagnosis. And of course, I'm glad to have that talk. That's why we're here today, and in general, why we have this podcast.
Yeah.
So prepare yourself. This is going to be long. I am going to talk a lot and give a lot of information.
Okay, get your notebooks. You
Yeah.
have lots of them laying around. They have pages available. Fill them in.
And even though, like, yeah, we have a podcast and we're sitting here talking to you, I don't like to listen to myself just drone on and on. So, Shelly, if you have something to add, interrupt, okay?
Okay, I'll do my like interjecting
okay.
humor thing. I'll do that.
Okay.
Okay. Cool.
So, my first hacking hypermobility life hack for accommodating yourself is fight the first fire. What do I mean? Take a step back, see what is the immediate need. Many of us feel overwhelmed, right? Like there's too much going on. So keep a literal list, write down a list of your health goals, periodically check in, list all the tasks, all the things you got to do, because that's where your mind is sitting in the spin of overwhelm. I got to do this, I got to do this, I got to do this. Okay, spit it out, write it down. Even if like you don't even come back to that list.
Okay, where do you write it? Where do you keep this list? Because I would start a list and then I would lose the list. So like
so
where
I'm gonna be honest. I have notebooks and stuff,
right.
but I do not use paper except to vomit out feelings or if I need to write down something real quick. For something like this, I organize my thoughts electronically just because that's what works for me. I have a cute little spreadsheet, and by cute, I mean terrifying. I have like a tab that's like my health priorities currently at this point in my life, my health priorities for this doctor visit. I have a list of all my pediatric symptoms. I have a list of all my adult symptoms. I have a health history of all of my diagnoses, my parents' health history, my grandparents, and then I have one of these spreadsheets for my child too.
That's
Like I said,
amazing.
it's
And a
terrifying.
lot.
Yeah,
How long
you don't have to
did
go
you
that far overboard.
But how long did you when did you start that? Like it sounds like you got a pretty good system. Like how long did it take you to actually decide that that was a system that was going to work for you? Because I think that's where I'm at now. Like I used to have like a bunch of paper, and then I took a big long
In
break from
general,
getting
I
sick.
switched from paper to like electronic organization years and years ago, like
Okay.
probably before most people were doing that, because that was how I learned how to accommodate my neurodivergence.
Okay.
I also, like, I would, if I didn't, I would have piles of paper and accumulate, and I just wouldn't
And then
go
that
through
would
it and
just
would be
stress you out.
organized.
Yeah.
But that's, like, even if I don't come back to this like list every month or whatever, it's still there. Like I can go retrieve it. I don't have to hunt through piles of papers.
Oh, you know where the list is then.
I just have a folder of like, and we'll talk about this.
Okay.
I have a folder of like medical things. So like I have my thoughts, my medical records,
All right.
the
I
kids, that
need
sort of
my thing a bigger. I've had a bunch of smaller things that get
thing. So I use that method for other things in life too, for like, I don't know, other types of goal planning or whatever. Um, so
I have
when I
never
sit back,
planned a goal.
well, so
That's not true. I'm sorry.
So that's the thing though. We're really hard on ourselves sometimes, and it's not as hard as we make it out to be. Sometimes it really is just writing it down. Like you don't have to have a whole darn plan every single time. Sometimes it's just giving it the words.
But okay, so this is where I struggle because I am not a rough draft person. And
I
so
am not.
and I know you're not. And so like I'm just in awe of the fact that you can like do that because I can't I don't want to do something unless it's like perfection, which is that I don't
I let go of
I
that.
have all
Especially
I
with this. Yeah.
so that's I just need to I'm getting closer to that. I'm not
And
quite
also
there yet with this.
because of my problems with perfection, one of the things that I was like, oh, well, if I just dump everything in this electronic folder and I use a large name electronic company to do this that's
One of our
known for its
overlords.
amazing search engines, all I got to
Yes.
do is be like, oh, I remember I wrote this down. Let me go search it up. And it magically finds it. I don't have to have a
I
fancy filing
know.
system. I don't have to lug stuff around. It's just there.
Yeah, I think I did move to a lot of digital, but then I just ended up with a lot of digital clutter then. So I think I need to like think
And I'm okay with
more.
that because I would rather it be digital clutter than in my life clutter.
Yeah,
Does
that's
that make sense?
fair. Oh,
Um,
100%. That's why I have a Kindle and not I still like books and I still keep a few
yeah.
books
And
that
so
like
I still read. I mean, like, I'm always just so like I still read books and
right.
still have paper, and like that's how I process things. Speaking of processing, like I process by writing things out. So
Yeah, me
sometimes I
too.
do, if it's got some emotion tied to it, do need to like handwrite it, but then I put it into like that. But so like we should maybe talk about this offline sometime, Shelley, why
Yeah.
you okay, I should probably identify and organize my thoughts and my goals. Why am I not doing that? So and that's where I was. I was like,
Yeah, what's the barrier to
well,
that?
but whatever I had let go, I'm like, well, that just wasn't a priority for me. Like I had these big career goal plans, I had big weight loss goal plans. And eventually I was like, wait a minute. I sat down and I like thought through what are my life priorities, and those things just weren't it. It was my health, it was my family, it was my personal growth. So like when I realized, okay, well, these are the things that are actually important to me, yeah, then it wasn't so hard to dedicate some effort into things that aren't inherently easy for me to do into those things because they matter to me. Anyhow,
Okay.
so we'll
Mm,
talk about that
okay.
later.
Yeah.
I'm not going to psychoanalyze you in our podcast.
I mean,
I have some avoidant tendencies too. It's fine. But the other thing is that maybe a sense of overwhelm that Shelley's feeling. Like she's probably overwhelmed with all the
yeah.
things, right? It's a lot. So like that's what I'm talking about. Sit down, get it all out, and then once you have like this vomit, you can like pull out the pieces and realize, okay, well, these are my priorities. So now I can work out a priority list and I can move things around and I can figure out, okay, well, I'm going to tackle one thing at a time. What is the top thing right now? And as you go through this, you know, how she's expressing, some frustration with this idea, it may help to have a support system in that. And that's one of the great things I love about our little community is we're starting to realize that sometimes some of us have energy or talents in different ways that we may not have energy or talents. So
Yeah.
find an informal way of getting support, like a buddy system, a support system. Rely on a trusted friend or family member that's aware of, your point and your symptoms. They can help keep you on task. They can help organize you or fill in the gaps in things that are a struggle for you. Is it hard for you to call and make appointments? Do you need
Yeah.
emotional support? Do you need communication support? Do you need them to be your voice? Do you need them to even track your symptoms? Do you need them to help bring you down and ground you? My partner is not an organized person, but he is a very pragmatic and grounded person who can very easily redirect my emotions and struggles with things.
Okay.
So,
My husband's good at that too.
um, you can even enlist the help of a formal medical support system. So if the idea of you being in charge of this yourself is terrifying and you don't have that informal support system, you may not be aware, but there are formal patient advocacy and medical support systems in place. You can request in most facilities what they call a patient advocate, and they help patients with complex cases or who maybe have disabilities or mental health challenges and that can't organize and prioritize their
Okay.
care or advocate for themselves on their own. Um,
Is
and a
that
lot
covered by insurance?
so a lot of times that's just something a hospital will provide.
Oh, wow.
Additionally, some health insurances, they may not advertise it, but they actually provide a care coordinator for complex patients. Many of them do. Just call and ask. And
Okay.
I did
Employ
not know that we had this as a benefit in our health insurance plan until my daughter started getting a lot of diagnoses and they reached out to me. And it's an RN, so it's a nurse who helps you manage complex care. And they helped us research providers make phone calls, find covered hospitals to complete, order tests, imaging, certain
Wow.
types of specialists. A lot of times they work with like complex patients or certain diagnoses that are in the best interest of insurance companies to manage things like diabetes, COPD, mental health
Gotcha.
issues, just things that, so it's a mutually beneficial arrangement, but you just may not even be aware that that exists.
My husband's employer, actually, it's not the insurance carrier, it's his employer
Your employer,
benefit,
yeah.
and they have a patient advocate type person, and so I need to just get with that person, and I just haven't because that's a phone call I don't wanna make, and my husband will make the phone call for me, he does do those things, he's just been so busy, and
Also,
I don't have the full bleh. Anyway, we'll get there. It's
you maybe
a lot.
sometimes, or maybe this is just a me thing, is it sometimes hard to ask for help?
Yes, because it goes back to that alexithymia thing where you can't explain very well, so it's easier for me to
You explain it away.
either for me to suffer as I had been, or just try to figure it out myself, or just suffer until I figure out how to describe it.
So
So sometimes
that's a
it
good
takes a
point.
long time.
So we're working through some kind of emotional blockages. So my next point is feel your darn feelings. Like allow that to happen.
I don't want to.
Me neither. But I'm getting past that. I'm actively always working on it. Mental health support from a therapist that is both trauma informed, aware of neurodivergence, sees if you are something like ADHD or autistic, and chronic illness aware is really helpful. They don't have to be all those things. Many therapists can adapt to treating different kinds of patients and
Yeah, I
different
feel like if they're
people,
gonna be
but
adaptable to the groups you just mentioned, any one of those, they would be
Yeah.
adaptable to
Yeah.
all of them.
You may have to, kind of experiment to find your person. Also, you you may need to find people that are like you, because the reality of it is if you have a rare disorder, it's unlikely that there's people around you in your life that really can truly empathize and understand and walk in your shoes with you. So find a community with similar disabilities, even virtual. That actually is why we do what we are doing. And that was one of the biggest things that helped me get through this journey as a mother with a sick child and find answers, suggestions with coping, paths to take, recommendations for providers. There's all sorts of aspects to that. A big part of that is just not feeling alone. Interestingly, I have found there is this organization that created the Autism Healthcare Accommodations Tool, and there's a website where you can go and it can create a customized accommodations report for individuals to give to their healthcare providers. It includes things that may make your healthcare easier, both before, during, and after your visits to like a primary care provider. And you go through and you take a survey, gives you some needs and ways to ask for accommodations. So
That's cool. I
I
had
know.
not heard of that. So we'll be putting a link up to
Yep, we'll
that.
put a link in here. So this is the Aspire Healthcare Toolkit. It was created as an ongoing research project by the Academic Autistic Spectrum Partnership in Research and Education, the Aspire group, to help improve healthcare access and quality for adults on the autism spectrum. The project is funded by the National Institute of Mental Health and is a grant recipient award for this tool, and the whole group. The website there, I've used it a couple times. It's very helpful. Even if you're not on autism spectrum, maybe check it out. It may give you some ideas. So the next thing that I, recommend, my hack, is the thing that Shelly and I both we kind of mentioned we don't like to do. Start tracking your symptoms, because that pattern and the systemic nature of your issues won't be identified by your provider or providers until you can really provide maybe a better, clearer, full picture. So
Yep.
track your symptoms in the ways that are accessible and make sense to you, and capture the full aspect of its effect on your life. So journaling and tracking, on paper or like in a spreadsheet, like my crazy self, may be hard to do with someone like ADHD. Maybe do a video diary.
I do that. I started a playlist on my TikTok of symptom tracking, mostly just new symptoms.
So she's
Just
killing two birds with one stone. She's
yeah,
keeping track of her own symptoms, but also maybe helping you, our
yeah.
viewer. It's okay if you can't do this every day. My kitty is saying hi. Apologize for
Oh,
that.
hi,
That's one
kitty.
of my coping things. That's one of my support animals. But it's okay if you don't have the energy to do this every day. It's
Yeah,
about overall consistency and being able to just get a good enough picture to articulate it when you need to when you're seeking care. Don't forget to include the feelings associated with the symptoms. Let it all out. Use it for your own processing, because we struggle with processing. Go ahead. Two birds, one stone. So there are some easy health trackers that you can do electronically, like in a smartphone or a watch, to help keep track of some basic vitals. Even when I was like really struggling with, I didn't know what was going on with my crazy heart rate drops and dizziness. I used a smartwatch, and that's when I realized blood pressures really are this low all the time. Like, what's going on? And then I had that. It wasn't just me saying, like, I get dizzy really easily. And they're like,
right.
okay. The next part in this is self care requires a lot of effort, and ongoing effort, when you are facing a chronic issue or a systemic problem that affects multiple body parts, because you have a lot of moving parts and pieces, different doctors, So manage the logistics of your healthcare journey in a supportive way that looks at both life balance and efficiency. Okay. So like make it easier on yourself, but also give yourself a little bit of grace. So think about pacing. Don't just like go full bore and schedule every single appointment that you possibly can in 1 month. You are going to burn yourself out
That is
unless you're traveling and you have the opportunity to go to a place that has all the specialists and maybe, kill yourself to go do it in a span of like 3 days.
And the other unless is right now we're kind of in a you take what you can get with appointment situation. And
Yeah.
so I've in the last few weeks I've had now I also have something going on that we haven't quite figured out, but in the last few weeks I've had so many things just like this, and it is
Yeah.
exhausting.
And
But I
I've,
also have to like
I've had a lot
take
too.
what I
And
can
then
get. And I hate it, but it's like
and then you
I
have to,
do it.
you have to balance. Like, should I put this off or should I go ahead and
Yeah.
go do this? But so even given kind of those access issues, you can still kind of pace things.
Yeah.
Like, being in physical therapy, I can, look at the schedule and try to plan things out. When I go to care, it requires a little bit of a drive for me. So I do tend to try to combine appointments so that I take less time off work and I disrupt our day, like in her school day, a little bit less. Make sure your tasks align with your goals. Like, what are you most focused on right now? Right. And trying to consolidate care into one hospital system is a really good hack too, if you can do that. It may not always be possible because of the limited amount of specialists in certain areas, but it will help streamline, referrals to certain specialists, get you in the door quicker sometimes. It makes communication easier. A lot of times, you can, if you're in one hospital system for most of your care, the communication to your doctors would be easier through their apps, but also between specialists and your primary care doctor. They're going to see, each other's notes and records very easily. Even though there are electronic health systems, I still recommend you request and keep all of your medical records in a central place. So
It's a great idea.
they do sometimes go missing, records. And even in the modern world, in the electronic world, health system programs get updated. They buy a new one. So your records from 5 years ago that you once saw in an app may not be there. So get them. Request and keep all of your medical records in a central place. Designate a file folder, a bin, a binder, whatever it is that works for you. I do digital, so I have a digital folder. But
Do you have any-
anything that is paper, I just have like a bin and I just throw it all in there. I don't organize it. I just put it in as it happens.
Do you have any
That's it.
suggestions for imaging that's on outdated media?
Okay, so yes. So most of the imaging, when you request the records, you can request both the format of the image as well as a printout. Get both.
Okay.
And then just go ahead and hold on to the whatever media it is, like if it's a DVD, CD, whatever. A lot of the imaging centers still can read older things.
I would hope so. I mean,
So see if your doctor participates in a health sharing platform. There are some pushes now that help link separate electronic health systems with permissions if you opt into that. So
Nice.
see if your hospital system has something like that. And that way you can link different doctors and stuff. Use the secret resources.
secret
help coordinate your
resources.
care.
Well, how do you find out about these secret resources?
Ask. So
Oh,
there
ask for
are-
help?
Yeah. Ask your doctor's office or hospital system if they have any resources for complex patients and care management. They might.
Okay.
Ask your nurse, your care manager, or your social worker at your doctor's office. Oftentimes, in a primary care practice, they will have a social worker on staff, and they are really good at helping those things.
Okay.
With those things. Take some extra steps that you may not think of. So call ahead. Talk to your doctor's RN, your registered nurse, and review the goals for the visit. Prep any concerns, accommodations you may need. Ask about your doctor's particular comfort or experience with your particular issue, or what you think might be the problem, the symptoms that you're having. Be proactive and take charge of your care. Don't just wait. If your doctor says, hey, you're going to need to do this, don't just wait for that specialist to call you. Like, get that phone number, you call them. You're in charge, not the doctors. Call and
That's a
message.
good reminder.
Yeah. Call and message if you're waiting on results and haven't heard from them. Don't just wait.
I'm really bad at that.
Don't just wait. You can take charge and initiate. Now, sometimes, are you going to be tired and exhausted and you don't feel like doing it? Heck yeah. But that's when we can enlist help, right? It's okay to ask for help. So if you do need certain accommodations for when you have a visit, like you need a support person there, there's lots of different accommodations you may need, like written instructions, that sort of thing. You can call ahead and request those things. I would recommend not just to like the administrative staff that's like scheduling appointments and that sort of thing, but with someone on the clinical side of things, like the RN that assists that doctor practice.
Okay.
Be open about your needs and limitations. So prep some talking points, because a lot of us have a little anxiety about making those phone calls. So just jot down some ideas, explain like, hey, I have this physical disability, I have a learning disability, I have ADHD, I have autism. So some examples would be, you could say, hey, I'm in recovery, so please don't give me any narcotic painkillers, but I do wish to discuss ideas to manage these particular pains I'm having at this next point. Another example is, I have PTSD from sexual trauma, so please let me know if you're going to touch me and talk me through whatever procedures you're going to do.
Oh, that's great. I hadn't thought of that.
Okay. Number 3 example, I'm overwhelmed with my healthcare. Can you introduce me to an advocate for help? Number 4, I've struggled with my weight emotionally. Please allow me to be weighed without discussion or seeing the scale if you need to weigh me.
I just actually went through that myself. I actually didn't say anything when they weighed me. I just had my back to the scale and got on, and then nobody said it.
The nonverbal communication.
Because I just didn't. And so here's another thing after you say your next point, I have something I want to add to it because I do. So anyway.
For me and my daughter, doctor's office visits are overwhelming because of the sensory experience. So I have said or have called ahead and said, I am autistic, or she is, and overwhelmed by the bright lights, loud noise, and struggle with communication. So please allow me to meet with the doctor for a discussion away from loud noise and lights with a support person to help me with communication. And I would like any advice or next steps in writing. Here's another one.
That's great.
You want to interrupt there? Sorry, go ahead.
Well, I was just going to say, like, I recently just realized I could like bring up the fact that the fluorescent lights were bright, like too bright. And so, but I'm still struggling to actually like identify myself as autistic with some people. The reason why is because sometimes the response I get is they're like, oh, or you don't look like whatever. I just don't. So what I have just taken to doing,
confusion.
Yeah. So what I did, like when the lights were too bright, like I was just kind of be like, oh, I'm really like I just like to have them actually see, how they actually like see me affected, rather than if I were to use
unmask
sometimes, but like instead of me being like, I am autistic, please blah blah, like, because then they'll just look at me and be like, but if I'm like, oh, this light, then they're like,
so you are okay to say I am overwhelmed by bright lights and then explain it. You don't have to justify it that far.
But see, that's me just working on my inner thing. Is I'm so used to having to explain why I do every single thing, I start
myself all the time.
Well, so I just start explaining things initially because I'm prepared and expecting pushback, and that's the thing I need to work through.
One of the best things you can do is just prep that explanation so that 1, you don't over-explain, or 2, you're confident in that request.
Like prep it in reply, or prep it like
script yourself. Like every
Okay.
other autistic person, do you not have scripts that you follow that you've said in the mirror before you go somewhere?
Um,
You'll use that technique.
Not
Go ahead, script
really.
it. No?
I'm good at winging things,
Oh,
except
okay.
for when I'm not. See?
Um,
Like, I'm
yeah.
really a lot of times I wing things, people don't know it, but when I'm
Oh,
bad
yeah,
at
me
wing
too. I wing most of
but
life.
when I'm bad at it is when it's very obvious.
I,
Anyway,
I, I wing a lot too, so I get it. But I also script a lot of conversation. Anyhow, so speaking of that, I struggle with telephone conversations. So please message me on your secure messaging system instead.
that's when I need
Okay. And then this one, I struggle with.
Ooh.
I have difficulty walking. I'm going to a very large hospital system. I have to walk 3 blocks. The parking's over here. Can you please help me find transportation or valet parking planning before my appointment and tell me exactly where I need to be dropped off so I'm not lost or overwhelmed or
Oh, there's
physically
nothing more
exhausted?
overwhelming than, like, parking at a big complex with buildings and not
And I can't
knowing.
tell you how many times I have been in like full autistic meltdown, but also in a POTS episode by the time I made it to an appointment because
Oh
I
my
didn't take
gosh.
care of these things for myself.
Yeah.
And then do you think that appointment goes well?
Oh, no,
No,
that's like a
because I'm
terrible appointment.
like my brain is not functioning. Yeah. And then all they're concerned about is how high my blood pressure is. And I'm like, no, usually it's
You
really
do
low. I'm just
Yeah,
stressed
here's
out
what you
right
don't
now.
understand.
Okay, so all these things, we're talking about like being really transparent and asking for accommodation. If you don't feel comfortable doing that, and if it doesn't always work, because sometimes that does
Yeah.
not always work, direct communication and accommodation as a disabled person is not always feasible. Game the system. Okay. Don't be shamed from doing research and preparing. These approaches will help you. Okay. It'll let you maximize the small amount of time you have with the doctor. But don't come in with like a conspiracy nut job binder without first gauging a doctor's receptiveness. So
Yeah,
some
yeah.
doctors don't like to be educated by their patients, but prepare yourself. So look up and understand the diagnostic process, testing, and procedures for what you suspect this particular issue is. In general, right now we're talking about the hypermobility diagnosis. So, be prepared, have that information, bring notes and a list of your demands, your goals, like we talked about. Be prepared with summary points, key questions, and concerns to help you and your doctor stay on task and accountable to your needs, what your primary goal is for this visit. It's really easy to get, like flustered when you feel dismissed or overstimulated, confused, or emotional, or physically overwhelmed from the long walk.
Yep.
A partner, if they come with you, can help ground you and return you to a task and goal. Don't let that medical appointment be one-sided. The system is that, they're going to tell you what to do. No, this is a partnership. Your doctor was chosen by you for their expertise, but you are the expert on you. You know
Yes.
your body. Be an active listener and engage throughout the
That's
conversation.
so hard for me
It's very
because
difficult for a lot
I'm
of us.
so I'm like,
So
why
it's
that
okay.
poster is out of date? Didn't they know that they
Yep,
updated that stuff? Like,
take
that's what
notes.
I do, and that's why I just bring my husband now,
Yeah. So
and
for
he takes
me,
notes.
it
I
helps me to stay engaged and not wonder if I'm like able to take notes on what they're saying and then like politely interject, ask clarifying questions, and then summarize. Okay. So like at the end, say, okay, so this is what I've got from your advice here. These are the tasks that you need to follow up on. These are the changes we're making. This is, like if they're giving you a prescription, yeah, go through your understanding of how and when you should take it, what you should look out for, any advice at the end to ensure like your understanding. We've kind of already touched on this. You are seen as the commodity and consumer in the healthcare system.
Yeah,
This is a capitalist healthcare system.
it's a
It
for
runs
profit.
on money.
Yep.
Even if you are in a system that's like managed care, or you're on disability or state funded welfare programs, you are still part of a for-profit healthcare system tied up in money.
Yep.
So shop for your care and know your rights. Okay. Doctor shopping is not a bad thing. That means you're an informed consumer. If you feel dismissed or unsupported, it is within your rights, like legally, this is in the patient rights. And best for your interest, really, to
When you
find a
say
doctor.
patient rights, is that federal?
Yes, they're
State?
the federal laws. Yeah.
Okay.
And some states have things like that. too.
Right.
It is in your best interest for you to find a doctor that will provide and give you the care that you deserve, right? If you're paying for it, pay for what you're paying for.
Yeah.
There are lists of doctors that are aware of and have treated connective tissue disorder patients, EDS patients, for example, on the EDS Society website. There are lists of queer-friendly and gender-affirming providers. There are lists of size-friendly providers. Get word-of-mouth recommendations. Talk
Yeah.
to a doctor or specialist that you trust. Ask other zebras. Go to those local online support groups. Don't just settle for a doctor. I mean, settle for a man if you must, but not a doctor, okay?
Yeah.
Don't settle for an answer or a treatment that doesn't sit right with you. Like if you're
Yeah,
feeling a
trust your
little
gut.
iffy about something, there's a reason, right? Okay. Sometimes things are just uncomfortable because of change or difference, but learn to kind of trust where your intuition is taking you. It
Yep.
is okay to ask for a second opinion, and you have the right to complain, and you should formally complain.
That's so hard for
Using
me.
the
The "and you should"
questionnaires,
part.
writing to a hospital, publicly online in reviews. Complain. If you are mistreated, complain. That's the only way other people know. That's the only way we can
I
hold
have
people
been
accountable in the healthcare system.
groomed to be quiet and not complain about stuff. So it's very or when I do finally complain, you get a dissertation, and then you also get, like
Or the pat response, yeah. But
and then you also get, like, all these recommendations on, "Here's how all of the ways you should have fixed it." And then they're
yeah,
like, "Why didn't you tell
victim
me this
blaming,
years ago?"
lack
I'm
of
like,
kind of okay. So
anyway.
we can either make excuses or we can en masse speak up for ourselves.
Okay.
Because that's okay. So you know what? When feedback is given, it is not always like going to be taken seriously until it starts being a pattern, right? So like if a
Okay.
doctor that we think of, oh, they're a great doctor, gets like one complaint, we'll think, oh, okay, well maybe they had a bad interaction that one day. But if a particular doctor gets 10 complaints a week, we're going to start to think, oh, wait, something's going on here, right? But if no one's
Yeah.
providing feedback, we have no idea how to manage any business or
I
healthcare
guess
system.
from my perspective, it's I don't I feel like I just send it out into the ether and it doesn't matter,
It
you know?
does.
And that's not to say that I necessarily want someone to call me after I
And you
submit that.
probably
Please,
can't, because the truth of the matter is they're not going
I
to
should
say, hey, I counseled my employee. They're probably just going to apologize and give you some like generic response. But the truth of the matter is that feedback allows for improvement
but how
internally.
yeah, if that happens. But I guess you're right. There's no harm in putting it out there. I guess
I think you're going to have to
this is where the jaded
take a
side of me
leap
comes
and take
in.
the leap where I do and trust that in general, most people in healthcare really do care about humans. They're not always good eggs, and there are people that don't always take the best approach every day, and there's burnout people, and there's a lot of problems in healthcare, trust me.
Oh, yeah.
But in general, most of the people that are involved in your care, even administratively, they genuinely care about other people. They would not put up with the insanity that is healthcare.
Oh,
They didn't.
I mean, I care about people and I didn't go into healthcare. So
Smart move. Smart move.
one of
Um,
I make those sometimes.
And healthcare is different now. Just gonna say
Oh.
that. So have some patience with your healthcare providers too. We're all a little bit traumatized. Anyhow, another controversial opinion: wear your mask. Wear the darn mask.
Well, yeah, germs.
No, not that mask. Not this one. This one.
Oh.
Um, I mean your mask that hides the severity of your level of neurodivergence and or disability.
But if
But use
you're
it
masked,
strategically. So
okay.
what do I mean?
That's yeah.
So find a
Clear.
balance. So mask to the socially acceptable level of disability and experience to be taken seriously. Okay. So it's not always safe to unmask, particularly if you're a marginalized group or a certain color in this country. Now, we're just going to be honest with you and say that we are not the only voices you should be listening to on this topic. We're white presenting women, particularly if you're more marginalized than us. We fully acknowledge we have certain privileges. Even as disabled people, we have pretty privilege. I mean, it, it's it's a thing
It's
to be a white woman of an acceptable level of attractiveness. Um,
or even an
and
above
also,
level, above
yeah,
average. I'm just kidding. That is a joke.
we neither one of
My
us think
hu-
that.
my
That's a bad joke. We also have a long-standing experience of masking neurodivergent traits because we went most of our life not being diagnosed or fully diagnosed. So seek the support of your own community of marginalization. Okay. So don't just listen to me if you're a person of color. Okay.
yeah.
But we're going to mention it because it affects how we are perceived as patients and how we receive healthcare. You can still say fuck the patriarchy and then embrace the patriarchy's rules. Be aware of
Yeah.
it. You don't have to condone it. Mitigate the bias in the way you present yourself in
Yeah.
healthcare.
If you want any kind of care, you're gonna have to dance with the devil.
Yeah. That's what I'm talking about. Yeah, you know what I said it earlier, and I'm not going to go off on the tangent. Yeah, systemic change is needed in this country and in healthcare, but you still have to live in this system, and you still need care, and you still need help right now. There's ableism, there's sexism, there's racism, there's classism. I could go on, and some of them are much more damning than others. I acknowledge that. But there are things we can kind of do to game the system. So you can dress and present your image in a way that gets you taken more seriously, but still reflective of your abilities and health. Look just sick enough, but pretty enough. Look just intelligent enough and speak just intelligent enough to show that you're somewhat educated. And be prepared enough, be emotionally, mentally stable enough, be casual enough to be comfortable, but be respectable. Think like a capitalist, because ultimately, what did I say? We are the commodity. Treat yourself
Right.
not as a person in that moment, but as the commodity that needs repaired. What's in it to society if they help fix me, right? To get the care you have to be valued as a commodity worthy of fixing, separate your emotional experience with medicine on the outside. Even though we're trying to integrate those feelings and emotions and struggles that we have with our healthcare experiences.
So I'm going to interject here and just here's something that I'm going to put out there as just something for you to be mindful of depending on where you are in this process. If you are I don't know where I'd characterize myself in this process. I feel like I'm kind of I don't want to say mid whatever. I've known about it for a bit and I've done some work, but I've still got some work to do. So I'm kind of whatever.
Same.
Um I have started tearing down the barrier between my mind and body connection, okay? And so I'm just warning any of you out there, if you have not done that yet, when you start doing that, it's great that you're doing that because you're becoming one with yourself, and I fully support that. Just be aware. Once you open those floodgates, they're open, okay? So the lights are always going to be brighter after that. People are going to be more peoply. they're going to be
You
so
will have a
peoply.
dark night of the soul.
You are going, yes. So, and you don't want to shut that back off. So that is why. And also it's probably why I never thought of making these calls ahead, because I had desensitized myself so much to them in the past when I was going to the doctor, but now I'm not. Now I'm tearing down those walls, and now when I go to the doctor, I'm like, "Oh, holy shit, I'm going to die with these lights. That lady's pen is scratching. I can hear Janice talking about her keto diet in the back. And she's also
It's
making some
so it's
appointment
not
calls.
easy.
No, like it's
That's
so
why I
like,
said what I said. This is going to be controversial. That's why. Because it is not easy once you've started supporting yourself and unmasking certain things to put that mask on. And I'm asking you, okay, well, mask harder now to get
yeah,
what you need. It's a little bit manipulative too. And that gives me the ick. It gives a lot of us the ick.
yeah. Actually, part of the whole reason that started my burnout into this whole thing with my pain was I really kind of just one day when I had that break after my that family event I went to, I was like, how can I be this person and this person, but also like true to myself? And I was just like, I can't,
And
and then I was like in bed for 3 days.
and Shelly and I have both been through what is labeled as autistic burnout, as we start to integrate certain aspects of being a disabled person. It's a struggle, it's an ongoing struggle. So when you then have to kind of take a step back, even for a moment, even just for an appointment, or you need to be in tune enough with yourself to gauge that fine line of like, okay, well, I'm going to mask because I'm meeting this new doctor for the first time, and then I can gauge how to respond accordingly. I
Right.
have doctors and providers that I don't mask with, but that's because I've developed
A
a
rapport.
relationship with
Like
them. Right.
yeah,
Yeah.
you've got that comfort level.
Right. So the point of this is, framing our experience more effectively with context, not just drop like, okay, well, I feel like this, or kind of vague things, but
Yeah.
you need to go ahead and work the system by explaining how it affects your life. So now that they're listening to you because you've masked a little bit, go ahead and tell them very specifically, this is the outcome and this is the expected disability outcome tied to capitalism.
Yep.
Even if, you know, maybe deep down they don't really agree with those things. That's how things get done. That's how medical care and any sort of accommodation or
They need
treatment
to be able to measure an
go about.
outcome.
Yeah.
They need to be
So
able to find an
it's
outcome.
always specific and measurable. Okay.
Yeah. So like for
Um,
me, it was like I drop things. Well, they don't care. Well, I've dropped things and I can't grip things so much that I've actually cut myself trying to prepare dinner, and I've dropped hot plates of food and I can't prepare meals for myself or
right.
my family.
Right. So
Oh,
do my
that's a
doctors,
problem.
yeah. So do my doctors care that I drop pitchers of water or that I can't paint anymore? No. Do they care that I'm missing work because I can't feel my hands to do my job
Yeah.
where I contribute to society in
Yeah.
healthcare?
Yeah, because
Yes, they
honestly,
do.
even cooking dinner for your family is not as
Yeah,
important
who cares? Right,
as yeah,
right,
as being a worker.
right. Yes, exactly. So in this, we've got a lot of feelings, right? Like we're kind of even holding back right now. Trust me.
I am impressed at how measured I am. I have not shed a tear.
Usually Shelly and I cry when we talk about hard things on our podcast or just not on the podcast, just, in
Yeah.
general, because we have started to integrate these things, those we're starting to let out these feelings, right? And that's a good thing, but you're going to have to learn as you integrate those things to practice very controlled emotional management and regulation with your medical professionals and your doctors. Your experience may be off-putting to a doctor, to the nurses, to the staff. And I say may, and let me clarify. I've seen it be off-putting. I've
How
heard
so?
from
Yeah.
other patients that we are dismissed because of how maybe severely we present and how crazy we appear. There are whole forums
So you
on Reddit dedicated to calling out illness fakers, and a lot of them are medical professionals. not all nurses, not all doctors believe all their patients. Okay, so
Ooh.
your
I don't really go on Reddit.
I don't either much, but I was told about it and I went and I saw it and I will never go back to that. My point is how we express ourselves, being differently abled in our body and minds, may be difficult for neurotypical and able-bodied people to relate to. Also, there's some desensitization and other issues related to being in a traumatic healthcare environment and healthcare burnout and post-pandemic world. I could go on and on. There's interesting dynamics at play here. But if you can manage to kind of regulate your emotions, even when it's emotional, for your healthcare appointments related to seeking your EDS diagnosis, you will probably be taken more seriously. This is why things like support and therapy are so vital. Reframing those emotions that will disconnect you with your provider or cause you to be viewed in a negative way in therapy or support before you bring those hard, challenging emotions into an exam room. Okay. That's not the place to like let it all out.
Yeah, I've done that a few times.
Yeah.
It didn't go well.
Because, sometimes honestly, like we do feel desperate to have answers.
Yeah.
We feel like we would do anything to be free from the pain. We have high expectations. We've built it all up in our heads. Like this is going to be the visit where like I get some answers. I finally get diagnosed. I finally get some help, some helpful suggestions. You might feel defiant because you've been disbelieved. You might be angry, like genuinely angry.
That's usually me. I'm usually like the angry, defensive, and then
And then sometimes it turns more inward, like you're anxious and defensive and you built up a wall, like we have to prove ourselves. And you just may not have clarity on what's quote normal or whatever. So take that to therapy. Okay. Take the rational stuff to your doctor. So you can't always just rely on therapy though. You really need to start incorporating a practice to manage your emotions and take care of yourself on a daily basis. So my next hack is to find ways to incorporate routine self-care into your life. I don't just mean like taking a bubble bath. This isn't an
okay.
Instagram.
That's what I was gonna ask. I'm like,
Okay.
a lot of people are like self-care, like, oh, I get self-care. Our husband watches the kids and I take a shower. I'm like, honey, that ain't self-care.
No,
That's
that's
like,
just bathing. That's
so
just basic
that's
hygiene.
well, yeah.
Okay.
So
And I'm
let's,
not saying certain things like wouldn't be self-care.
well, for sure. Like I know I've gone through
Really,
time frames where I've struggled with taking
yeah.
a shower.
Really,
But
sure.
how, when you, I guess just for me, because as we discussed offline, like you also are a little more advanced in your self-care routine, or maybe we'll find as you go through yours, I'm actually doing things that I didn't realize were.
So maybe, and that's what I was going to say, is maybe it's because I had to stop and start prioritizing this in my life. So I've just, thought about it more. Maybe you're just more integrated in your approach. And maybe in some ways a little crunchier than most people. I will admit that. But it was a development out of necessity. This is not something that came natural to me. Okay. So routine self-care. What do I mean? So I mean on a regular basis, working on self-trust and self-love. So it's number one, it's hard to trust a body when all you can perceive is that it seems to fail you all the time. But you're
Oh,
not
now we're
broken.
gonna have tears. Okay. All right, sorry, keep talking.
It's okay if you do.
Keep talking.
It's hard. This is hard stuff. Okay.
Yeah.
Your intuition is not wrong. Listen to your body and embody confidence in yourself. You are valid even before being given a diagnosis. Don't obsess over your health. Balance this with other passions and wellness pursuits. While it's tempting to spend hours and hours looking up EDS on the computer and doing lots of research or binging on all of our TikToks, as much as we would like the views, don't lose sight of who you were before you had to embark on this this quest, okay? Embrace the person you're becoming through this because you will be different.
Yep.
And this gentle advice is from someone who has read and continues to read every single research study about connective tissue disorders and reads neuropsych medical publications for fun. Okay. Like that's okay, but balance it. Assess your boundaries. Create boundaries where maybe you didn't have some before to protect your energy. Okay. So like understand your changing
Oh,
ability.
I'm gonna interrupt you for 1 second. For the eldest child, the eldest daughters, boundaries are these things where you say, if you want to engage in X activity with me, Y needs to happen otherwise not. Or you can something to that effect. And you're allowed to like say things like that. I recently learned this. Anyway,
So
carry on.
I'm also an eldest daughter and have some family trauma. We won't talk about it right now, but so I'm going to define boundaries.
Yeah, she's gonna
You
define it
touched
better
on it,
than
but
me.
I'm going to make it real clear to people if you don't understand what a boundary is. A lot of times people think that a boundary is about someone else's behavior. If they are doing something or behaving in a way or speaking to you a certain way, that's on them. What's on you is how you respond to it, right? So a boundary that's a true boundary and is healthy is saying something like, if you continue to speak to me in this way and yell at me, I'm going to end this conversation. And then when they continue yelling at you, you walk away. That is a boundary. Okay. So boundaries can be hard, they can also be subtle. Okay. Understand that you may need to reassess your daily life and priorities. For me, it was a big crash and burn. Okay. Including like, how you relate to others, how much you can do for others, in different arenas. I'm talking about, career work. I'm talking about volunteer activities,
I had a
your health
volunteering
pursuits.
problem for a long time,
We'll
several
talk about that
years.
someday.
Yeah, but that's how yeah. So I finally was like, oh, I don't have to fix every
Yeah.
nonprofit organization that exists in my community. And so
Shelley
I
and I
don't.
also both had a pattern of like defining our health by some high physical achievement and try to be runners.
Yep.
And we eventually realized, wait, this is not so good for me. We had
No.
to redefine a boundary of what health and strength and endurance and loving your body means, right?
Yeah.
So that's what I mean. It can be more subtle. It's not just those sticky relational things. It's also like how you define your life and how you operate. A big part of, self-care is being adaptable and understanding yourself and assessing those ways you define parts of your life. But also give yourself some grace. Give yourself some time and space and probably more than you think you need on a regular basis for emotional processing and feeling and releasing. It's okay to sit in the suck of it all because it really does suck sometimes. Just, like, don't stay there. And while media may have you think that self-care is all about like those Instagrammable things like the little bubble baths, mani pedis, or whatever, that's not what I mean, okay? I mean, sit there and ask yourself, how do you show your mind, your soul, and your body that you love yourself? Shelley, what are some key self-care practices that you do?
Okay. Well, now that you've taught me a lot about what the different types of self-care are, I actually, well, I've incorporated things since this journey started, but I had previously been doing things that I didn't realize were at the time. And so,
This is an intuitive practice for Shelley, whereas I had to learn these things because I never took care of myself.
yeah. So something that I had done always before, and I didn't realize why it benefited me, was padding days on the front and back end of trips or vacations. And for me, I was always like, oh, it's because I get in this like fury. I get in this like I get hyped up and I need this extra time, right? Before and after. And like, okay, we know what that is now, right? That's like anxiety. But for
Let
me,
go
it
and
was,
let Shelley.
yeah, it's a little bit of let go and let Shelly going on there. You should have seen me yesterday before my daughter's party. That's well, that'll be like bonus content or something. But like,
You should
I
totally throw up a picture of the cake because I thought it was gorgeous.
oh, okay, I'll put a picture of the cake. And I did not make this cake. I used to
No, but it
make
was so pretty.
amazing cakes. I
Oh,
actually did.
but what I didn't tell you is, and I
Oh,
didn't send this to you, I tried making one of those rainbow cakes. When Evie was 3, we did a whole
yeah,
big rainbow party. Don't do it. Just pay for the
just
baker to
yeah.
make a rainbow cake.
Yeah.
That's the other hack in this
I
episode.
also
Just
did
pay the
not
baker.
stress. I also because I generally don't like all those dyes in my
Yeah.
food. But I did not stress about it for this particular cake. I was like, you know what?
Only poop is fun.
The beet juice is not going to be the vibrant red. And so I just sucked it up and we ate all the colors. Now I'm learning that that was like my body, I had already noticed kind of my body's patterns during these things. And so I intuitively added those things. But I started adding that to more things. So I took it, I was like, oh, this works when I go on a trip. What else does it work for? And so I started adding, and it's not always days, it's just chunks of time. So I've become more aware of transitions are not good for me. I
Buffer.
pad my buffer zone. So I've intuitively been adding my buffer zone and I've been increasing it. And now that I'm symptom tracking, I am mindful of how my buffer zone changes based on what's going on in my
I
body.
have to interrupt right here.
Go ahead.
I don't I don't regularly or hadn't regularly given myself buffers. And I really didn't become aware of it until I was a mother and I realized before Evelyn was, I realized what autism in girls was like and on any of
Right.
that. I would tell people she needs like a buffer time to adapt. You need to tell
Yeah.
her ahead of time what to expect and she'll be just fine. Otherwise, she can't handle the change. So I had built that into giving that to my child. That just, you gave me an idea. What
So,
you give to your child, give yourself the
yeah.
grace to do that for you.
Do you want to know why I probably intuitively was doing that for myself?
Yes.
Well, because if you listen to the previous episodes, you know that my son was diagnosed autistic in 2007. So that was 15 years ago. So I've already, like, in my life had been padding because of needs that he definitely had those needs, but other people in the family also had those needs. It wasn't
This is such
we
a mom thing.
it yeah. So okay, so that's why, so that's self-care. Another thing I started doing, and it was after I had run Ragnar, when I was like, I'm going to be a runner and be let me fix my body, I'm going to do this. I got a massage after, and the massage therapist was like, "Wow, you've got this tightness." He had remarked that like I had a lot of tightness. It seemed like I was overusing my muscles, and I was like, "Well, I'm training for this event." Well, I had decided after that event I was going to do like a series of like get massages for like a few months in a row and see how that helped me, and with the same person, so that I could get some good data, like if like it's actually beneficial. And it turns out that it was beneficial and it was helping me. And so I actually got into the wellness plan at the local massage place, and I get a monthly massage. I found that if I don't get some time outside every day, I feel a little bit off. Yesterday, when I was getting ready for the little garden party, and when I show pictures of the cake, I'll put up some pictures of the yard too. But we had this one weed kind of get into the flower meadow, and I didn't wear my garden gloves because I'm afraid of my garden gloves because I left them outside and then spiders took over, and I am convinced there's a colony of spiders inside my gloves and they're just gonna go in the trash or I'm gonna light them on fire until I get my new gloves. But so I was not wearing gloves, okay? And I was using this tool at first because I didn't want to bend over, but then I was like, no. And I just listened to my body and I like got down on all fours and I was like raking in the dirt, like pulling these weeds out. I had dirt in my and then I smelled like the earth. It was it was I was like, what is happening right now? It was
Okay.
good.
So have we talked about my obsession with the smell of dirt?
No, but now we're
No.
going
Okay.
to.
I'm not gonna hijack. Okay, so we're gonna take a little pause here, but
Yeah.
I really, really relate, and so I'm going to interrupt Shelley, and she was talking about the time in nature and getting in the dirt and all that. In spiritual practices, we call that like grounding, communing with nature, whatever you want to call it. A lot of humans, we just don't do this anymore.
Yeah.
I used to have this recurring dream of as a child that I was a tree. It's very weird.
Okay.
And I would smell the rain on the dirt. And it
Well,
has
I
a
love the
word.
smell of
It's
rain.
called petrichor. And my favorite smells are the smell of dirt, petrichor, and like the smell of ozone. Like
I
it
love the smell of
gives me
ozone.
life. So one of my self-cares was I found a perfume that has those smells in it, and I have some essential oils that I put in that smell like that. And
Ooh, you're
it like
giving me
takes me
ideas.
to that moment. So even if I can't go out there into the wet dirt, I can bring that sensory experience to me because it's like a safe grounding thing for me. But
Yeah.
yeah, the dirt under your fingernails. Okay,
Yeah,
go on.
so that was something I did that I realized, okay, I had previously spent more and more time outside, but that was the first time I really like got down on the ground and was like, oh, this is like it was almost like carnal. I cat therapy is good. I love my animals. I got oh
Mhm.
pretty kitty. I will like find either a new show or something to dive into. So like I'll
So like
find
a
some
entertainment type thing. Yeah.
yeah, I'll just kind of try to find something to I
So
don't know,
I struggle
that's
with
more of
attention.
distraction. That's not self-care.
Yeah, I struggle not necessarily unless it some some television I consider like great literature. Some music I consider distraction, but I consider Taylor Swift like a poet. Depends, right?
Yeah, well that's music is big for me. So Muse actually just came out with a new album, so I've been really like
Yes, and it made me cry, but we're good.
it's good. It's good. I've been currently stimming on the song Compliance. Like there's this really cool like
Yeah, I know. I love it.
electro beat on that I just go
I didn't even know, and like I think you told me like the day or day after, and I listened to it, and I was like, oh well, you could have put a warning label on this for me.
sorry. Sorry. But that's really I think I don't know because the that's that's all I can think of right now. And I bet when you tell me yours and then I'm gonna kind of go through and
Uh,
make
Can
notes.
I
But
can I
other
make
things
an
like
assumption based
yeah,
on what I know of you?
sure.
You are to me like you do take the time to like try to address the pains that you have in your body. Like you made a TikTok today or yesterday with all the little like tools that you have at your
That was
disposal
today. I was wearing this
today.
shirt.
Yeah.
I
But
was
also
feeling
like
cute, made a video, you know.
I think you design your life to be supportive in your environment. So like you have made choices about the people that you spend time with. You've
That
made choices
okay.
about, accepting things. Well, I can't work like this anymore. You, you, you have, okay. I haven't been to Shelly's house, but like we've seen bits and pieces because we talk on video and stuff.
Yeah.
You have like your home is yours and it's like designed for you and your family in ways that like I maybe design my house maybe more aesthetically. Like I have spots and places that are comfy zones or whatever.
Right.
But you like really like your dining room, your kitchen, your like,
Oh, you mean the room that's not a dining room, that's actually
yeah,
like a
like
lounge?
literally, yeah. Like
Yeah,
you,
that's fair. Okay.
like I
Yeah.
think, oh, this is great. Like I want to be more like Shelley in that way. Yeah.
Oh, oh, that makes my heart happy. That what
Um,
TV character said that? You make my heart
I don't,
super happy.
but there's those, so those, okay, heart happy things. That's what it is.
Okay.
It's heart happy things.
Okay, so Pilates is on there for me too.
Yeah. Because, okay, so Pilates feeds your body and your mind and all that in a way that
Hmm.
running was maybe not doing, right? So you found a
Yeah.
way that
Yes,
gives you
because
strength and yeah,
running, I never actually I mostly just did the running thing out of spite.
right? Like I'm gonna do this.
Yeah, like screw you, body. Like, what are you talking about? I can't run a half marathon. Watch me do this shit. And
I
then
did
I
it
would
to like
do it.
prove something.
Yeah,
Like
and like
prove
who
it
at
that
the
I
end of
could
the
do it.
day, my body was like, I'm
You
still
know
gonna
what?
fall apart, bitch. Like, it didn't care.
Maybe we
Shingles
don't
doesn't
have to push
care. It's like,
ourselves to that insane level of badassness to really be a badass. Like, just saying.
but anyway, so
Hmm.
now I listen. But yeah, for a long time, that's a new thing. The making the house my own, that's relatively new. I think that's the pandemic thing. That's being
Yeah, yeah.
and like, and the diagnosis on top of that, I'm like, okay, I really am gonna embrace, because I probably would have preferred all of this time to have a dining room that's more of like a lounge coffee bar or podcast area now, um, this whole time, than have some form.
Okay.
Like, I didn't even want to register for China when we got married. And I'm gonna, after I tell this, I'm gonna tell you a story about that, just because I have to, and we can cut it, but we can save it for like a snippet. Once I was here all the time and I got on TikTok and started seeing people doing things in their homes that made sense to them, like,
Hmm. Did you
why
have a
am I not living in a home that makes sense to me?
yeah.
And so I started doing that, and it felt good, and it was, it my in-laws were visiting. There was a TikTok, and I ended up making it friends only after, because it was the first time they had sprung up on me, that they hadn't sprung up on me. I knew they were coming. The notice that they were coming was a little short. But then the day that they were arriving, they actually arrived even earlier than they said. So I thought I
It just
had more.
wasn't enough of a buffer, and then they took the buffer.
Yeah, exactly. And so I rolled up to my house and saw their car on my street, and I just kept driving. I was like, nope.
It's out.
And so that was self-care. In hindsight, that was self-care. I was like, I recognized something, and I was like, if I go in there knowing like I'm off, I'm off. I already know I'm off. They're here an hour and a half ahead of what they were supposed to be. They got here early. I was supposed to have time to come home from my thing and peace out and go do my other thing and not even see them. So it
And so
was
Shelley knew herself well enough to be able to have
that.
the insight to say, this is not going to go well.
Yeah.
I'm going to make the choice that may not seem as socially acceptable.
Yeah. And so I did. I drove away from my house. Fortunately, my bestie Carrie lives 6 doors down. So I like pulled up. Actually, I drove around for a little bit. And then I texted her, and I was kind of like, hey, here's what happened. And she's like, okay, come on over. So I did that. The other thing that was helpful was I had an inn on the inside. Now, my husband would not have cared, but he was like entertaining his parents. I promise you, this is going to be about making the space yours. I promise you. My mom was here visiting also. So I was texting my mom. She's got me, right? So I text her. I was like, Mom, I saw their car there. I'm not doing, I was like, you got to cover for me. Just tell them I'm still at Pilates, like, tell whatever, like, make some shit up. She's like, all right, I got you, but you owe me. So anyway, so this was shortly after this whole thing went down, was shortly after I had gotten rid of my dining room table and I got that new pull-up coffee table, and I have the two love seats in here. It's like a different.
Mhm. It's like the Friends coffee shop.
Yeah, that's a little bit of the vibe I was going for.
Yeah.
Just like,
Chill, relax,
just a
loungy, comfy. Yeah.
chill, yeah, except
Gathering spot.
I,
Yeah.
yeah. My mom was like, oh my gosh, I just realized they might listen to this one day. But you know what? It's fine.
No, it's
It's
cool.
fine. Chris and Charlie, I do love you as human being people. I love you. You're great people. I'm
We
so
just
glad.
we just talked about this was a boundary about Shelley, not
Yeah,
about them.
yeah. But I thank you for bringing forth Alec into the world. He's the best. My mom reported that they were very concerned about how they were going to eat lunch. Like it was this whole big thing. Like, well, where do you eat? Where do you eat? How do you eat? And my mom was like lifting up the table. Like she has like, look, I'm sitting here and I lift, like she even demonstrated the table and was like, but she said they still sat with their plates on their laps. Like they still did it. And I was just like, and so honestly, I now it's been a bit of time since all of this occurred, and I have my official diagnosis now. Like a lot of things have changed since
Yeah.
that happened. But just knowing what my mom told me now about how they reacted about the area and me being thrown off with them showing up early, it is so, so, so
That's
very
like
good that I just kept driving because I would have rocked in feeling all pleased with myself about this cool room I created and then had to defend it to people who wanted to know why I didn't have a traditional dining space.
yeah.
And
And
so,
so and I love it. Like
yeah,
just saying.
yeah,
Some people will get it.
yeah,
It's okay if not everybody gets you.
yeah. And I said I was going to say something else, but I already forgot what it was. So, anyway, that was
Making you
self-care.
face your own.
Mm,
I mean, that's what it was about, right? I
I
don't
don't know.
know. Maybe after we publish the podcast, we'll remember.
Yeah, when I'm editing, I'll like put it in here. I did remember the story I was going to tell. So I had mentioned China, which I did not want to register for. I had not found my voice really when I was 24 and registering for my wedding gifts and stuff. But anyway, I got talked into registering for China. And after the wedding, we had received one place setting out of 8. Mind you, I ended up registering because my mother-in-law was like pretty insistent, and she said, don't worry, my family is going to buy it for you. And then I got one place setting. Anyway, so I returned the place setting after our honeymoon. And then about 3 weeks later, I got a delivery of 7 place settings. And they were from my husband's uncle, who did not attend our wedding because he was teaching in Hong Kong. He was overseas. And yeah, so then I had to go buy the place setting I had returned. And now I have 8 place settings of China that are packed up in a really fabulous container in my utility room. Like
Yeah.
a voiceover. I don't know. So that's some self-care. I've gotten better at that.
I
think
have
that's it. Yeah, I don't
like
know.
a small little list. But for me, like before I say, hey, these are the things I do, and Shelley
Not
pulls
only does
these
she have a
things
list,
together,
she has categories. I love it.
I think it's
I
important though that
aspire.
we accept the flexibility in this, the adaptability in this, and then it may need to change. Think of it as like you have a little toolbox and you make a little list or you have a little whatever, and you just pull something out. And if it suits you for that day or moment, it suits you. This isn't like an obligation. This is a, hey, I love myself and I'm feeling a little icky in this area. Maybe this will help that. Okay. These are some of the like core things for me. Primarily, it starts with like personal development, spiritual growth, my spiritual practice, which was previously non-existent really. The types that have worked well for me are somatics and body work, attachment and relational base to help me through those.
Did you know
Um,
I didn't realize there were different types of therapy? Like that's how like yeah.
this is when I realized that my special interest in psychology is not a
Yeah.
it's a special interest. By the way, if you spend a lot of time researching how to people,
You mean like getting an undergraduate degree in anthropology?
yeah, You might be autistic. Okay. Anyhow, so attachment or relational based, interfamily systems, IFS, and nervous system regulation techniques are the ones that have served me well. I've also learned a lot about trauma therapy,
Writing down nervous system regulation techniques.
polyvagal theory. I've read a lot to help me process and understand myself and others around me better. But what I was doing was intellectualizing. Those types of therapies are what really kind of get out those feelings and allow you to grow as a human.
Okay. I do remember being told frequently in my sessions that I was into like, okay, those are your thoughts, you're intellectualizing. Let's talk about your feelings. And I would be like, yeah, but like when I feel, I go blib, and it becomes this whole thought. So
We could do a whole episode on that.
thank you for bringing up the other things. I'm making a note of them on a piece of paper that I promise I will not lose.
And then the big category of like support,
Okay.
your support systems. For me, it's also creative expression, of which this is something. This is a creative expression for me. Connection to my chosen loved ones, prioritizing my health and peace, and then sharing and giving back when I have the space and energy. One tenet of this is unplugging. For me, unplugging is something that I never really allowed for myself before, but really it's been a very intense need my whole life. I'm somewhat, because of the emotional processing delays and trauma and being autistic, I need more downtime and quiet time. Number one, so I'm not overstimulated, but number two, also because like there's processing delays. I need the literal time to like catch up.
Yeah. So when you say
and then-
unplugging, you're not just speaking strictly electronics. This is
I mean,
disconnect,
like from everything,
a conscious
like
disconnect.
from obligations,
Okay.
from social engagement.
And
Yeah. So when I burnt out, it was a crash and burn. Now I try to do that regularly, and I've been able now to assert my need for that in a way that the people around me can accept it now. Previously, it was very much a point of contention in my relationship, actually, that I needed so much disconnected time. My daughter also requires this. And so to watch
Mine
an
too.
11-year-old do this because she has the encouragement of an adult that has learned how to manage this and do it intuitively and with respect and not, feel bad about it, it is it's a very validating thing to see it work well.
Remember all those nice things you said to me in episode 2?
Sure.
Yeah, you don't.
How
I see
about
that.
being a good mommy?
Well, yeah. Well, what I want you, I'm going to pause and point out that you do it too.
Yeah, I do.
Yeah.
I try. It's probably one of my guiding forces in life.
And so now I'm taking a moment to point that out about you. And that's beautiful. And I hope you know how beautiful that is and
Thank
how
you.
lucky she is to have you to be her mom, even on some days when she's like, you're so cringy. Cringe.
And that's the truth. Like, I'm cringy, but you know what?
I have a playlist named Cringe, so
Can we share that later?
I
would
haven't
like to
put much in it. I need to go through and figure out all the ones
Add
that are
more.
cringy.
I
I
can
probably
add.
deleted most of them. Anyway, carry on.
So this is like that's that retreating from the world and stimulation, but also it's the time to do that inner work. I would say I was an emotionally stunted human because of the way I was raised, the way I was cultured, the line of work that I'm in, and also my nature, being autistic, being disabled, dealing with things that other people don't deal with, going through some of the life experiences that I've gone through. I was not given the opportunity to like develop the emotional side of myself understanding
Yeah.
until I was older. So I've spent a lot of time doing like that inner work, not just in therapy, but also like the self introspection, the understanding in this in the spiritual world, you hear it called like shadow work, like understanding how you operate and why, and what parts of you want to change or embrace that you maybe weren't. I spend time journaling, not so much to like record anything for posterity, because frankly, nobody can read my handwriting, let alone myself later. It's mainly just about getting it out
That
because there is
physical
a processing
action.
delay. It's an expression and a release. So also like I
Thank you
need
for that. The one reason why I don't write is, well, A, the terrible handwriting, although I did find some splints I'm going to try. But because I can't read it after, I never thought there would be any value in it. But it sounds like
there is.
there might be
This is
for
my
me.
other life hack. Just get one. I literally bought like a case of these on Amazon. I'll link it for you if you want. They're just like little, I think they're called travel journals, and
Okay.
they're like, small, so you can kind of tuck them in a bag, or like I have one in my nightstand. I have, just wherever. And I just like I write out like things I've learned or I'm working on, or feelings I need to, I don't know, it just depends on the day or the moment. And one of the things that I had to do to kind of propel myself into feeling feelings was the physical practices, the body, the release stuff,
Okay.
and then incorporating that into like some self-understanding was really difficult because I had such a disconnect.
Right.
So I did work with some intuitive practices that maybe are a little non-mainstream. I've done like some meditation, and
Remind me again, do you have aphantasia also?
yes,
So,
I just didn't realize it. I don't think it's as severe as some other people. It just takes a lot more effort.
okay.
And I
And
think
I have like
honestly, I
black
think that's why I'm
screen.
such a good artist. Like,
Ooh.
yeah, it's funny. But
The
so
reason why I asked is because you've mentioned meditation and self and reflection and introspection, and a lot of times imagery is
it was
associated with
developing
that.
these things
But
because I didn't have the self-awareness, or I wasn't allowing myself time to process and understand, well, what happened here? Am I really understanding this correctly? I spent a lot of time, like we said, intellectualizing, but not. Yeah. So when I say meditation, like I cannot just sit there and do the like whatever. So I have tried something called the Wim Hof method, which is a method of breath work, and it's
okay.
guided. Okay. So almost everything I do is guided. I cannot
Yeah.
do this alone.
There's
And
a hack for you. Find the people
yeah,
have already done the work out there. You don't have to try to invent the
yes.
wheel
There's various
yourself.
apps, there's free things, there's YouTube, there's all sorts of things.
There's TikTok creators out there who do
Yeah.
series or go live and do this stuff.
Yes. And as I was getting into this deep work, I was introduced to some spiritual practices, like I said, that aren't necessarily mainstream. So I got
Right.
into like things like astrology and tarot, and like archetypes, Jungian type of archetypes and stuff like that. Better understanding like human stories, and
Okay.
then seeing where I could apply them to myself. So it was like I don't. I'm a, like astrology. I'm not impressed with you if you like know your big three, like your sun and your moon sign. If you follow this at all, it's okay
Okay.
if you
Yeah.
don't.
I'm like,
I'm
big three.
impressed if you use that to like do some self-reflection and be like, oh, like, is this how I do XYZ? And then you assess, like, well, how do I handle an emotion or whatever in your life? I don't know. And
You
so
know what's interesting about that is when you apply that view to astrology, it's not pseudo whatever.
it's not, it really isn't. The other thing that I do that is also controversial, and you should know that I was an evangelical born again Christian before I deconstructed that too. And before that, I was an atheist. So, anyhow, the other thing that I did
I
was,
am currently an atheist, and as long as I can remember forming a cogent thought on if I believed in God, I have not.
so
Show me
I
your book.
picked up
Oh, show me your
tarot.
cards.
And tarot was actually something that was quietly taught to me using playing cards by my grandmother. In our ethnic background, it's a common practice. Again, the point of tarot isn't that the cards are telling you something, it's that you see the card and it has an archetype in it, okay, right? Like it has some sort of image or symbolism, some sort of story culturally assigned to it. But how do you, like, where is that energy in you? Where is that in your life right now? So again, it gives you, it's like a writing prompt, okay? It's
Yeah.
not a, you are the energy. The card isn't the energy. The stars aren't the energy. It's within you. So it gives you, it's just, so those like rules of astrology or those pictures on a card are putting into space where I struggle to put into space or images or thought the opportunity to do that inner work. That's a way to overcome things like emotional processing delays, disconnects like aphantasia, alexithymia, and stuff.
So, sorry, I interrupted you, but I was getting ready to like, you made me think of something. Is
Is it
that,
there still or did it leave?
no, it's there. I just did, I
Oh,
just,
interrupt.
is that why and this is just a pattern I've noticed. And so I don't know if there's any science or merit to it, if it's been studied at all. But I'm big into like the nerdy comic book science, fantasy, Lord of the Ring. Like, is there are
Okay,
people, is
so
there more
Lord of the
neurodivergent
Rings,
people?
Star Wars, those big, sweeping, dramatic sci-fi fantasies, Dune, they all speak in esoteric truths. I'm not going to go down a rat hole right now,
Yeah.
but they are telling these big stories of human experience that speak to the truth of who we are and why we're here.
Okay. I just was noticing like a lot of
They're just
people that
palatable.
tend to be like me. I would run into people like me at say like I've been to Dragon Con quite a few times. That's in Atlanta. My cousin lives down there. We do some cosplay, we go to some panels, we like nerd out, right? There's a lot of like-minded, seemingly
So, in
neurodivergent
all
folks
fairness,
there. So I
like
just
I
did,
get
you know,
it, but I
yeah.
don't get it. I only one time I accidentally was on the fringes of a Comic Con because I was at a healthcare conference
Okay.
and we were the same uh,
Yeah, if you don't, it can
hotel
be,
complex as
yeah, it can,
a very large Comic Con.
yeah.
And I'm not gonna lie, I was a little terrified of those people.
Yeah.
And also that is the Comic Con that Lou Ferrigno hit on me in the elevator. And I didn't take him up because whatever. But so maybe I was just put off by that. But like I may be on the fringes in some things. And I love sci-fi,
Right.
but like I think that's how I know how autistic I am. That terrified me. Like I would never have been able to go in that room.
Hmm. Oh, I know why I could do it. I was drunk.
So
Yep.
speaking of coping skills that maybe aren't healthy coping skills, let's substitute things like drinking and things that numb things for healthy coping skills. That's really what self-care is. It's how do you deal with the shit of life in a healthy way? How do you process it? How do you love yourself through it? So, like, I talk about the me time thing, being away from the overstimulation. Uh, I'll take a bath to soothe the pain. I spend time reading. I used to read a lot. Like, I was I was hyperlexic. I read very early. I spoke very early. I was a very precocious child. I finished my elementary school's library. I read early. But then I stopped. I stopped reading. It was no longer something I could even focus on. Now I really generally only read for like, not for quote pleasure.
I haven't been able to read really. I switched to audiobooks for a while and
So
then I couldn't
yeah.
even do the audiobooks after I
So I do
finished grad school.
audiobooks and podcasts, but generally I just listen to nonfiction and things that are within my special interests. I I don't even really watch like entertainment television or so that is something like for me, I think it was a numbing behavior. It was like alcohol for me. It was
Okay.
a way to disconnect. And now I can't even focus on it. And I wish I could because I would love to enjoy like sitting there watch a movie with my family or whatever. So on the flip of that, now I also focus on, this is almost even harder for me, plugging in. So the inverse of that. So like connection.
Okay.
And I have, some things again in my nature that preclude me from connecting with others easily. Autism, trauma, fun stuff. So like I work on sharing my creative expression and now my health experience. This gives me life. Like that's why we do this, why we share on TikTok. I'm
Yep.
speaking for Shelly and I'm both of us. That's part of our connection thing, connecting with you all. I love to learn about things that I care about, my quote special interest related to healing, trauma, psychology, neurology, anything EDS, but I try to do it with a balance, like I said. And then conservation, like who I choose to share my light with, my
Yep.
time, my energy. I try to only share it with people that match my energy. I have a small group of friends. I don't have intense connection with certain family members anymore. I allow myself the challenge to reorient to new friends now that are more understanding. And that was a big thing for me. It was a lot easier for me to just shut down and not connect with anyone. Now I am trying to like find my people, right?
Yeah.
The other part of this is outside of the cerebral stuff to do with your body. I try to find ways to love my body, even though a lot of times it doesn't seem to love me back.
Yeah.
With something that feels either empowering or calming. Like I like to try to feel strong again. I'm not quite where I was, but I spent many years seriously weightlifting. I coupled that with water aerobics, and that was the strongest, I had felt since like my whole life. Even when I was an athlete, I still didn't feel strong because I was injured all the time. Now I know why. That's very much recommended for EDS people. Right now, since the pandemic, that I didn't have access to a pool and now it's a struggle financially. So we go swimming in the river. That meets two needs. It's both the water
Yeah.
exercise, but
And
it's also
nature.
a cold river. Cold water exposure is part of that Wim Hof method that I referenced, that combines breath work, meditation, and cold exposure. Nature walks. What Shelley was talking about, grounding, being outside, being in nature. I love going on hikes. I love going away from this city to where I can't, see the traffic. I can't, I don't know, hear the sirens I hear right now. Like where it's just the woods. I can touch the dirt. I can sweat. I can see the beautiful butterflies and the flowers. And I am like a little child. I collect all the interesting little things. There's other ways that I love my body too that maybe I didn't do before to such an extent when I was more able-bodied. And I realize I've kind of transposed it into things I can do now. I am obsessed with makeup. I have a makeup hoard, a makeup collection. I put on makeup most every day of my life. Even if it's like a no makeup look and you think I maybe don't have makeup on, I have makeup on. And I realized like in a way,
Really?
oh, pretty much. Not every day. Like you've seen me without makeup. But
Okay.
like I pretty much I have to force myself to take days off because I've come to use it as not only is it a mask to like make me feel better about like how I look because I look much sicker than I appear without makeup.
Yeah.
But I found out how much it gave me back the joy of creative expression. I told you I, wasn't painting or creating
Yeah.
artwork anymore. And it was a way of like doing that, incorporating that into my everyday life. And then another one that like is empowering and like connects you to your body is intimacy. Like, and I don't mean just that kind of intimacy. I mean all
Right.
those kinds. Like I actually take time out and I call it cuddles. Like me and my daughter every night spend time before she goes to sleep, the same as we have since she was a baby, where I hold her and I cuddle her and I give her little forehead kisses and I tuck her
Aw.
in. Like I take time out of my day to connect with those that like, I love. Now, of course, can be those other things too, but I generally mean true intimate connection, not just sexual type things.
Right.
Those things can be both too. Not knocking that.
Yeah. Well, non-romantic intimacy
Yes,
is important too.
yes, yes. And connection is soothing too, to anybody in both parties.
It goes back to the not being alone in the world.
It is a method of nervous system regulation, which those of us with autonomic dysfunction need. Anyhow, the next idea is undoing things. What do I mean by undoing things? Undoing the things that maybe you did or someone else did or situationally that just aren't helpful. For me, it was facing trauma, family issues, any of those things no longer serving you, questioning outside systems and their place in my life and the world I see for my daughters. I talked about deconstructing religion. That's one of those things. The next thing is not undoing, but doing. What are you doing? What are you putting your energy towards that gives your life meaning, that contributes to the world in a way that you want to? So seeking like meaning and growth, redefining myself in the light of disability and trauma. What is my legacy? Like, what am I doing today that with my energy, no matter how much energy I have, and it's okay if I didn't really do anything today.
Yep.
But when I have energy,
that is a hard lesson to learn.
Yes, because like Shelley said, we were defining ourselves and what we were giving back. We were both doing volunteer work, and I was doing that as well. The next thing is thinking beyond just right now. So thinking about tomorrow, how am I going to make tomorrow Luna happy? It includes things like planning ahead, prepping for the day, the meals, clothes, packing the bags for soccer practice, school, taking care of my body so I'm healthy, keeping up on my medicine, my vitamins, allowing myself to rest. And then my last and best hacking hypermobility hack for self-accommodation, self-care is I eat chocolate every single day. I count for the calories, but I love chocolate and I'm not giving it up.
Hell no, I like that.
It's one of those happy things. Okay. So you don't have to eat chocolate every day. I'm not telling you to do that. But if there's something in your life, no matter how little, that makes you happy, do it. Okay. That was a lot.
That was a lot.
Shelley.
But that's great.
Do you have any ideas I didn't bring up?
Okay. Well, I do have a few hacks that you didn't mention, and there's a big reason why you didn't mention one of them.
Could it have to do with my gainful employment?
It did. And it actually interfered. I abstained for a long time because of my gainful employment. And this is not to say that if you partake in cannabis as a medical or recreational endeavor that you, oh my God, I forgot the word I was going to say. We were talking about upstanding. Oh, gainful employment. The reason why we're just saying gainful employment is because there's restrictions based on our job. I do not believe
cannot partake in that for reasons legally or where we live or the fact of the nature of our jobs.
Yes. Yeah. So anyway, one of the things that I would say is a hack is when you talked about honoring yourself and thinking critically why you're doing things. One of the things that I was doing was just listening to what doctors said all the time. Take these vitamins, take this ibuprofen, do this, do that. You'll feel better. And I never did. And so I ended up.
By the way, you cannot live on ibuprofen. You will destroy your liver. Anyhow, go ahead.
Yeah, well, that's just it. And so I had some blood work come back, like my liver enzymes would be doing weird, like it was affecting my body. And so as far as like pain management goes, like my options were becoming limited because I was doing damage to my body by trying to make my body feel better.
Yeah. Well, and that's common. Most of the pharmaceutical interventions have, even those that are non-narcotic pain interventions, if they're pharmaceuticals, have other effects that, in my experience, have not outweighed the benefits. I do not take pharmaceutical pain medications. I manage pain in other ways that don't fully manage, to be honest. Yeah.
Yep. In that same vein, I don't really take pharmaceutical pain level medication either. I can't remember if we mentioned it in a previous episode or not, but I'm not quiet about it. My sister is in recovery. She's been in recovery for 9 years from opioids. She it was not good for a long time. I also had genetic testing done and things that I've learned in addition to the actual experience of watching what my sister went through, is that my genetics also indicate that I am highly prone to be an addict when it comes to an opioid type
Mhm.
medication. I don't want it. I don't want it. And so I was getting to the point, well, okay, well, I can't take
This
over the
is
counter.
non-opioid podcast.
Yeah.
We're going to actively stand against opioids.
Yes.
Just to say that right now.
Yes. So what's left for me, right?
Right.
Well, fortunately, I live in Maryland, and well, the dispensaries didn't open until 2017. I think it's 2013 is when the legislation started passing, I think. But I got my medical card in 2020
For
for cannabis.
cannabis.
I have a medical cannabis card. I had been using cannabis prior to, technically illegally. I'm of the belief it should not be illegal, federally or otherwise, regardless of its use. But I also avoided it. I worked for the federal government for a number of years and I didn't use it. I I think my drinking got really, really bad during that time too for multiple reasons. But I think like, some of that pain, you can't do this, so something's got to give, right? That has been, in addition to opening my mind to the problem that I had with alcohol, it has also opened my mind to, as we discussed earlier, that you brought up, a more holistic approach to my care. And so that's my biggest hack right there, is if your body can tolerate it and you have access legally, I say look into it. You don't have to, if the idea of smoking freaks you out, you don't have to smoke it. I ingest it in a variety of ways. And that's because in addition to finding out I was genetically predisposed to be an opioid addict, I also don't process, my body does not always process medications or foods or things in a timely manner. And so there are edibles, and sometimes they hit me in 2 hours, and sometimes they don't hit me at all, and sometimes they last for 12 hours, and sometimes it lasts for an hour. So I cannot rely on edible dosing to reliably manage my pain. So what I do,
And it is not unusual for connective tissue disorder patients to have problems metabolizing medication, pain medications, etc.
Yep. Yes. So that is a frequent, yes, slow gut motility, and just also anything, also just through your liver
Neurological differences.
and yep. So that is something I've had to struggle with. So I do, even though I don't want to be like, yay, smoking, I do actually inhale, and I get the purest distillate resin. Like I get the best quality I can get, but I also dry vape the flower itself, because then I can use what's left over to process items. And then I also make my own topicals with coconut oil, which you can ingest, but also make into lotions and balms and salves. I've made tinctures. And so that has been, I had mentioned previously that I had been being treated for inflammatory arthritis, which I do not have. And I had been taking hydroxychloroquine, sulfasalazine, all of these things that, if they provided any relief to me, it was minimal at best, but that required me to get regular blood work and more frequent eye checks, because I already am at risk with my eyes. So I had to get my eyes checked more frequently. I had to get blood work done to make sure that my liver and my kidneys and everything weren't becoming angry at these medications, right? Which, by the way, again, I was taking for a condition I do not have. And once I got my medical card and began adding that to my care routine, I slept better. My bowels were better. My skin looks better. I don't take the prescriptions anymore that I was taking. Now I still take some prescriptions, but I don't take those.
I would like to point out if some states don't allow THC, but some states allow CBD.
And
I
also
am
the hemp CBD is
yes,
okay.
so
Yeah.
hemp-based products. So I am in a state where we can purchase some of those things, and once I was able to try topical CBD, uh, I was mind blown.
Yeah. You have so
There is a
many
difference.
endocannabinoid receptors in your
Yeah.
skin. And so that's why topicals,
Yeah.
CBD topicals can work
Yeah.
so effectively. Yeah.
Yep.
I'm glad you tried it.
I have met with a pediatric pain specialist, and basically their answer is if you have a child that's in severe chronic pain, try it. There is no research. There's never going to be research because no one's ever going to volunteer their child to be studied on a
No.
plant-based medicine. We only allow children to be studied, with pharmaceuticals. Anyhow, so that's the point. But, they said it's not hurting her and it's better than the other options we have.
Yep.
So I do use that on a child, by the way. And it's, topical pain management. There's some other choices, and we use them in combination with some other things like arnica, Voltaren as well. But that tends to be one of the more effective options. Just saying.
Yeah. Yeah. And I think that's really the only thing to say. I mean, I think about future Shelley a lot and like what future Shelley would want. But present day Shelley is struggling.
We can
Basically,
always be planning for tomorrow.
yeah. And so what I'm doing now, instead of like present Shelley knows future Shelley wants some things, and that's fine. But present Shelley also knows that future Shelley is wants to cut present Shelley some slack. And so I'm getting better at that. So one thing that people would say to me all the time, and I didn't realize how much I actually needed to, was to cut myself some slack. I've never done that. I've been my own worst critic, hardest on myself. Outwardly, I'm the best ever, and inwardly I'm like, I gotta get my shit together. Like, meanwhile everybody's like, wow. Yeah, it's anyway. So
Give yourself a little grace.
yeah.
I think that is the last hack.
Yep. That's
Maybe
it.
one of the more important ones. What did
Yeah.
I say? We are not broken on the inside. Give yourself a little grace.
I can't believe you didn't ask me about this shirt.
Oh, what what is going on?
I saw you looking at it earlier. You were like, what? Because I'm
How
not a
did you
dog
know I
person.
wasn't just looking at your boobies?
Oh, well, I mean, those are nice too. But anyway,
Jokes, bad jokes. Is that a bear?
this,
What is it?
it is not a bear. This is Ghostbusters. No Dana, only Zool. Come on. My friend Ben is an artist and designed this. This design is called Must Love Dogs. Okay.
That's great.
All right.
Should we does he still sell those, or does he just
I have to check in with him. I've had this shirt for a number of years. He also designed my bird tattoo that I have on my back. So I'll reach out I know he's on Instagram. So I'll
No,
find out.
Dana.
I'll put his info in there. But
Okay.
anyway,
No,
my goal, I've told, I don't know if you guys have noticed, I like my nerdy t-shirts. So I'm going to try for every episode have some kind of fun t-shirt that we can discuss briefly or at length, depending on the topic
I have
of the shirt.
2 fun t-shirts. Maybe.
Oh,
that's not me.
yeah. Well, yeah.
I just assumed to not be perceived.
Okay. This is a perception that I'm fine with.
I know.
Because
it's,
either you,
it's funny. It's funny that I had to have it explained to me. I think maybe if I could see it, like I would.
do you remember explaining to me that masking wasn't about masking? Okay.
Fair enough. Fair enough. And
We
I mean,
all,
I watched Ghostbusters like a few times. It was not computing. It was like out of context.
yeah. I mean, it's a little bit of a dated reference. It's,
I mean, what year was that? I mean, I don't know. I saw it in the theater, so
the same.
anyhow. Okay.
So what's next?
I don't
Do
know. I
we know
think
what
that
episode 4 is? Like, are we thinking ahead? We gotta do our closing. We didn't even wrap up. Are we done? Are we done with the hacks?
yeah, I think we went through the
Oh,
hack pretty well,
okay.
right? I mean,
All
like
right.
I
Yeah.
mean, are you good? Do you have any other ideas? I think we've probably exhausted everybody, but that's a good place for everybody to start.
Yeah. All right. We're close it out. Close out. Psh, psh, we're done.
Okay. So thank you for listening again to the Hacking Hypermobility podcast.
And I'm going to say this time, but one time I'm going to make Luna tell you that if you like what you've heard so far, take a few minutes to give us a like, a comment, and a review. And please share it and tell people because we're starting to get a little bit of traction. And
So
it's
good.
not, we want just to be, we're energized by your interactions with us. So, like, if you're listening, like, let us know. And you can find the show notes and links to all of our socials out there at hackinghypermobility.com.
Yeah, and really it doesn't matter if you like leave a rating however you listen or watch because that brings in more views and I don't necessarily care about the count of views or the
Yeah.
fact that like we're getting interaction. What I care about is that we're spreading the message and I think um you should know that's our mission to
Yeah.
bring awareness, but also to bring some practical applications on how to cope with all this. And so, if you can help grow our podcast, we can help bring awareness to more people. So, thank you guys so much if you take the time to do that. Here's wishing you healthy hypermobility. Have a great day, zebras.
Bye.